Right. So this is a common question that our patients are asking us. What can I do to stay healthy, to age well, to age successfully? And really, there's not a simple answer to that. I mean, there is a simple answer, but it's not easy to do. The number one thing that everyone should be doing, the number one intervention is not a medication, it's not a special diet, it's exercise. And it's not always what people want to hear, but we know that regular exercise and regular physical activity absolutely affects the way that we age, and can prevent a lot of the things that happen more commonly with older age, namely preventing your risk of falls, preventing frailty, and especially preventing cognitive decline or even dementia. So, if you really wanted the biggest bang for your buck, it's regular physical activity. There's no doubt that social isolation or decreasing socialization certainly can contribute to your risk of developing cognitive decline or even dementia, but it's probably a much smaller percentage as far as the influence on your risk of developing these conditions than being physically active and exercising regularly. So there's no getting around it. The biggest thing that you can do is really to stay physically active, although important to remain socially engaged and to use your brain in other ways as well. Yeah, interestingly, all forms of exercise have benefits in different areas. So, flexibility and balance might decrease your risk of falls. But if you're really worried about your cognition and you're concerned about wanting to optimize your cognitive health, it seems that regular strength exercises or resistance exercises, as well as aerobic exercises, seems to be the most beneficial for your brain health. It can be aerobic, so it really depends. When we talk about aerobic activity, it's any activity that might make you a little bit breathless. So when you're talking, you might be a little short of breath, not to the point that you're going to pass out. Obviously, we don't want you to be overdoing it, but aerobic exercise is one where you become a little bit breathless. So that could be walking briskly. For others, they actually need to go a little bit faster than that in order to become breathless or to have that aerobic. And resistance, it can be very low weights, even 1 or 2 pound weights has been shown to have benefit. And it really doesn't matter which muscle group you're targeting. Just the fact that you're doing some sort of resistance and strength training seems to be great for your cognitive health and obviously good for other reasons as well, including bone health and other things that we think about that become a little bit changed as we get older. So I think a lot of people might be intimidated by hearing the words weight training or resistance training. But I remind them it doesn't have to be, we're not talking about lifting massive weights and doing a deadlift from, from these huge weights on the ground. We're talking about slight resistance. So it could be exercise bands. It could even be going upstairs because that is kind of a resistance and muscle wall sits, push-ups, wall push-ups. All of those are considered to be resistance and strength training and of benefit. Yeah, so in this area, we're really talking about what we call primary prevention. So these are for people who have no evidence of heart disease in the past, have never had a stroke, don't have diabetes. And the idea is starting a cholesterol lowering medication in order to prevent those things from happening. So that's what we're talking about with primary prevention. We have a lot of evidence of benefit in younger adults. So those younger than the age of 75, it's kind of a no-brainer. Everyone who has high cholesterol should be on some sort of cholesterol lowering agent in order to decrease their risk of developing some of these conditions. Over the age of 75, the data is less conclusive. Either it doesn't exist because they never included older adults in the trials, or it's kind of balanced by some side effects related to the medications, namely muscle pain or weakness or interactions with other medications. So right now, we don't actually have the best answer for that. And so it requires a more nuanced discussion with your patient as to whether or not they're really going to benefit from starting yet another medication in their regimen, or even stopping this medication if they've been on it for a while, whether or not that makes sense for them based on their life expectancy, their current health, and kind of what their goals for their health is. That all determines a decision or a recommendation on whether or not to use these medicines.